Good afternoon and hello everyone. Welcome to today's event, Buying Home Blood Pressure Monitors to Support SMBP, How to Get Started, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and events specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleagues, Meg Meter and Rita Lewis. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this live event is approximately 90 minutes, including introductions, presentations, and Q&A. Again, the duration of this live event is approximately 90 minutes, including introductions, presentations, and Q&A. Thank you so much for everybody that registered, obviously in advance. That's how you're here today. And you submitted such a plethora of questions, and we're so excited to answer those later on during today's session. But again, you might have questions as things come along today. So the Q&A box is going to be open. It's located in the lower right-hand side of your computer screen. Simply type your comments, questions, or concerns into this box at any time. Select to all panelists and hit send. We'll answer questions. We have a nice, robust Q&A section at the end of today's session, so feel free to type your comments, questions, or concerns into this box at any time. Friendly reminders that today's event is being recorded and will be available for a playback. Attendee lines have been muted and will be muted for the duration of this event. The Q&A box is open, ready for your comments, questions, or concerns. If for some odd reason we cannot answer your questions in the time allotted or we need additional resources, we will either answer you privately or submit that in our FAQ document that will be presented with a package to you folks. And then you'll be presented with a brief survey after this event has been completed. This lets us know how we did, how valuable this event was to you, and directly informs us of future training and technical assistance. At this moment, I'm going to turn things over to our first presenter, Cassie, who's going to be setting the stage for you folks, and we will get started with today's session. Cassie, the floor is yours.
Thanks, Liz, and hi everyone, I'm Cassie with NAC. So before we get started, I want to mention that we have created some handouts to help you through your home blood pressure monitor selection process. The first document is the Choosing a Home Blood Pressure Monitor notes sheet. This may be helpful for you to use as a note-taking template during the device showcase portion of today's webinar, or also to use during your own device selection process. The second document is the Home Blood Pressure Monitor Scoring Rubric. This document can be used to assist with determining how important specific features or criteria of these devices are to your health center, HCCN, or PCA, and then how to score devices based on those criteria. So though this webinar will be a great starting point in your device assessment process, it is recommended that additional individual research is completed before scoring devices using this rubric. So both of these documents are available on NAC's website through the link on your slide, and you should also be seeing a pop-up on your screen that will allow you to download these documents in real time. We also have a third document that will be available very soon. It is an at-a-glance comparison of all the devices that will be showcased today. So this document will soon be available also on NAC's website through the link on your slide. So we hope that you will find these handouts helpful. And with that, I'll turn it over to NAC's Chief Medical Officer, Dr. Ron Yee, to get us started.
Thanks so much, Cassie, and good day to everyone. And thank you again for joining us. As Cassie mentioned, I'm Dr. Ron Yee. I have the privilege of serving as the Chief Medical Officer for the National Association of Community Health Centers. And just want to take this opportunity to welcome you to today's event. NAC, along with its partners at the CDC and the American Medical Association, are hosting this opportunity to support health centers, PCAs, and health center controlled networks and other organizations in their efforts to prepare for implementing self-measured blood pressure monitoring. This pandemic has really magnified the need to have systems in place to care for patients remotely and measuring blood pressure and monitoring at home and other places. And as we know specifically, hypertension affects 1 in 2 adults and is a risk factor for poor COVID outcomes. So our purpose for today's event is really to equip you all with the information you and your teams need to be able to make informed decisions about purchasing home blood pressure monitors to use in care delivery contexts. So this is so that you can both be successful in your SMBP efforts, but also so that you can optimize any funding resources you might have to purchase devices and on into the future for remote care. So again, welcome, and I'll turn it over to Meg to go through the agenda. Meg?
Thank you, Ron. I'm Meg Metter, Director of Clinical Integration and Education with the National Association of Community Health Centers, and I'll be facilitating today's event. So a quick review of our agenda. First, we'll have our colleagues at the CDC and Health Federation of Philadelphia share some key considerations in purchasing home blood pressure monitors. We'll hear after that from the American Medical Association about the validated device list. I know we received some good questions in our registration about the difference between clinically validated and FDA certified devices, so he'll certainly cover that. We'll hear from some of my NAC colleagues on SMBP reimbursement and tips for getting the best possible discounts. Then we'll have 4 top device manufacturers showcase their products, and we'll wrap up with some additional resources. So before I introduce our speakers, I do want to make sure that everyone knows that while we won't be able to hit every aspect of SMBP today, given the scope of this particular event focused on device purchasing, we did receive a lot of great input through our registration and tried to incorporate as much as possible in today's event. We also did plan time at the end of today's presentation to answer your questions. So we won't be pausing after each presenter to take questions, but please feel free to add your questions as you have them into the Q&A, and we'll do our best to address those at the end. Next slide. I'd like to introduce our first set of speakers today. So we're going to be hearing first from Hillary Wall. She's the Senior Health Scientist and Million Hearts Science Lead for the Division for Heart Disease and Stroke Prevention at the CDC. After that, we're going to hear from Deb McGrath, who's Director of Health IT with the Health Federation of Philadelphia. She's going to be followed by Nar Ramkissoon, who's Senior Manager of Improving Health Outcomes with the American Medical Association. And then we'll wrap up our first set of speakers with 2 of my NAC colleagues, Cheryl Modica, Director of the Quality Center, and Danny Hawkins, who is Senior Vice President of Community Health Ventures. Next slide. So following our first set of speakers, we're going to be hearing from our 4 device manufacturers who will profile their home blood pressure monitors for you. These include A&D, Hillrom, Wellchannel, Omron, and Withings. Representing these companies are Greg Lilligard, who's the Chief Operating Officer of A&D Company America, Vince Constantine, Director of Channel Management and Patient Monitoring Diagnostics from Hillrom Wellchannel. He'll be co-presenting with John Hogan, Marketing Manager of Wellchannel Home and E-commerce. They'll be followed by Karen Lucarelli, who's Director of Marketing and E-commerce for Omron. Tim Shipman, Head of Sales for the U.S. for Withings Health Solutions, will be co-presenting then with Logan Harper, Business Development for Remote Patient Monitoring Solutions for Withings Health Solutions. So next, I'd like to turn it over to Hillary Wall, and she's going to start us off with sharing some important considerations when selecting a device for your organization. Hillary?
Great. Thanks so much, Megan. Good afternoon, everyone. So as you're thinking about blood pressure devices to purchase or recommend to your patients, we've compiled a list of things for you to consider. These are not set in stone, but some good considerations. First, consider selecting a validated device if possible from the US validated device listing. All devices sold, just to be clear, in the US have been approved by FDA for sale, but the American Medical Association has really spearheaded an effort to highlight devices that have been validated above and beyond FDA criteria. And so you're going to hear more about that in a bit. We always recommend upper arm devices whenever feasible. Wrist devices have the potential to add more user error than an upper arm device does. But we want to acknowledge that it may not always be clinically appropriate to use an upper arm cuff, but when it is, that's definitely the preference. Next, for health center populations and frankly, the US population in general, having an extra large cuff available is extremely important. When we look at data on the US population from a survey called the National Health and Nutrition Examination Survey, we find that among people with hypertension, 50% of men and almost 40% of women need a large adult cuff or bigger. Moreover, our CDC team collaborated with NAC on an accelerating SMBP project where over 50% of participants needed an extra large adult cuff. And while those project findings may not be completely generalizable to the entire health center population, I do think it reinforces the idea of choosing a device that has an extra large cuff available. Bluetooth-enabled devices that can automatically transfer patients' readings to a repository are definitely something to consider. We're really trying to, as a nation, move away from paper logs where cherry picking of readings could possibly occur. And we want to move towards interoperable solutions that seamlessly move data from patients to clinicians. I know many of you have questions related to technology, and you'll hear from Deb McGrath next about additional technology considerations. And I just want to let you know this is a topic that many of us are actively working on. Very quickly, an AC adapter is nice so that we don't have to rely on batteries. Memory storage capacity and multi-user capability are ideal. And having the capability to average measurements is really a convenient option for a device to have, but not deal breakers. However, ease of use is very important. You can buy a device with all the bells and whistles, but if patients have difficulty using it, it really defeats your purpose. So we recommend purchasing one device and doing some sort of usability testing with a few of your patients. Is the interface intuitive? Is it complicated to put on? Answer those kinds of questions with your patients before going ahead and purchasing lots of those devices or recommending them to patients. You're going to hear more on insurance coverage and reimbursement in a minute, but coverage is an obvious issue and a barrier that many of those who work in SMBP have been trying to address for years. We have seen some slow progress in this area recently. For example, I think we're up to 32 state Medicaid programs that cover an automatic upper arm device. So that's really positive and a baby step in the right direction, but we still have more work to do there. Related to coverage, obviously, is cost. You can get a good device that meets many of the considerations listed above for $50 to $100, but obviously that can be a barrier for many patients. And one of the ways to curtail costs is through group purchasing. And again, we're going to hear more about this a little bit later. But now I'd like to turn it over to Deb McGrath. Thanks.
Thanks, Hillary. Good afternoon, everyone. My portion of this is really going to be focused on the work that we're doing with about 10 health centers, standing up SMBP programs. And what I'd like to suggest some of the following considerations as you're thinking about devices. The first one on the slide here is device integration, and that means really thinking about what devices do you have in circulation in your organization, and what is the platform that the patient's going to use to connect to that device, and if it's possible to select a platform that is fairly universal and maybe not device specific. It may help with the onboarding process and enrollment process at your health center. The next one is sort of data integration. So thinking about that data flow from the cuff to the mobile device that the patient is using to the clinical staff. And I recommend thinking about how that data will be viewed and consumed and documented in your electronic medical records. Will it be every individual blood pressure or an average? Will there be context provided around the average BP, the high, the low, the number of blood pressures that constitute that average? Will it go directly into the EHR, blood pressure by blood pressure, or will it go to a holding area where it can be, those blood pressures can be viewed and validated? Will the provider and staff be able to differentiate a blood pressure average versus an office measurement for reporting purposes? So thinking about your end game. Will time of day be available to them? Will it be available to them to see whether this is a Bluetooth enabled measure coming in or if it was entered manually in some way? Another area that we've run into as we've been putting these programs in place is whether or not the device manufacturer or the clinical portal that you might be using to view blood pressures are able to provide sort of BAAs or risk mitigation around any kind of a data breach, given that in many cases, blood pressures are being stored in the cloud with some patient information so that they can be associated with an individual patient. And then finally, thinking about the technical support. What happens when something goes wrong? What happens when blood pressures aren't reporting to the clinical portal, for example, as expected? What happens if Bluetooth is a little bit wonky or not stable and not staying connected? So some of the other work that we're doing, and maybe at a different time, is talking about digital literacy and how that can be supported with patients as they're enrolling. And I think am I handing it back over to Meg? Or
you are.
Okay, great, thanks.
Thank you so much, Deb. That was excellent. So next we'll be hearing from Nar Ramkissoon from the American Medical Association, and he's going to talk a little bit about the U.S. blood pressure validated device listing. Nar?
Great. Hi, everyone. Thanks, Meg, again, for having me on today to talk about validation, what it means, and how you can identify validated blood pressure devices. Next slide, please. So let's start with what validation is and why it's important. Validation means that a manufacturer has taken steps to ensure that their blood pressure devices produce clinically accurate readings. This is why the use of validated devices is specified in clinical guidelines, scientific statements, and most recently, the USPSTF recommendations. Physicians and care teams need to be able to trust that readings are accurate if we're going to move the needle on blood pressure control. Now, validation involves rigorously testing a device according to an internationally accepted validation testing protocol. So essentially a clinical trial where devices need to show a low margin of error to pass, which sounds pretty straightforward. Unfortunately, there are some challenges. Protocols get updated every few years, requirements get tougher, they get revised, some protocols are even sunset. Only a few of these device studies ever get published in peer-reviewed journal articles. And sometimes it's not clear if the device that went through the testing is the same one that's available on the market today. And there's a particular concern around cuffs and cuff sizes that were used there. So a few years ago, the AMA convened hypertension and measurement experts to consider all of these factors that impact accuracy and asked them to develop a set of criteria that can be used to determine if a device can be considered validated. So listed here on this slide are all these requirements that must be met, which really does set a high bar. And again, many of you are wondering, how is this different from FDA clearance? Blood pressure devices go through the FDA 510K clearance process, so it's not like an FDA approval, in order to be marketed and sold in the US as safe and effective. It's essentially an expedited path that permits manufacturers to claim that a new device is substantially equivalent to a previously cleared device. Now, the FDA does not do testing, nor do they review validation test results as part of clearance. That in-depth assessment just isn't within their legislated purview. So if a device is FDA cleared, that does not necessarily mean that it's been validated. So the validation criteria listed here really does include FDA clearance as a necessary first step, but then builds in these additional requirements that helps address any uncertainties and provides more assurance that blood pressure readings are clinically accurate. Next slide. So now we need to know which devices on the market today actually meet these criteria, and that means checking each one, which is of course a huge effort. Now, to tackle this, the AMA enlisted NORC as an independent third party to develop and manage a submission and review process. The independent review committee was formed to complete these reviews in a very standardized way. It's comprised of physicians with extensive hypertension research and measurement expertise. They review documentation on each device submitted by a manufacturer and decide whether it meets the criteria. Again, this is a completely independent process. The AMA does not play a role in the reviews or the decisions. Next slide. And after the committee determines that a device meets the validation criteria, it gets published on the US Blood Pressure Validated Device Listing, or VDL. which is the first of its kind in the US that launched just last year. Now, we certainly want you, your team members, and your patients to know that this is available for use as a resource. You can view the current list at validatebp.org, and you're also able to print out this list if needed. Next slide. And the good news is the list is growing with 2 devices added just this week. Currently, there are 27 models from 7 manufacturers on the list, and that includes ambulatory devices, automated office, professional office, community kiosks, and of course, your home blood pressure devices. In a bit, you'll hear more from the manufacturers with a home use device on the VDL. Next slide. And lastly, we encourage all manufacturers to submit devices for review so that the list and options for validated devices continues to grow. So if there are vendors or manufacturers that you may be in contact with, please share that they can email NORC directly, get started with the submission process. And that email is vdlsubmission@norc.org. Okay, great. Thank you, everyone. And I hope this was helpful. Meg, back to you.
Thank you, Nar. That was great. So several of the comments that came in through our registration process were concerns about reimbursement, which makes sense. So I'd like to turn it over now to my colleague, Cheryl Modica, to share briefly on SMBP reimbursement.
Thank you, Meg. And yes, the next slide, please. Today's conversation, as Meg said, is largely focused on a discussion around the devices, but we'd be remiss if we didn't at least touch on the issue of reimbursement, recognizing how critical it is for health centers to be paid for the work that you're doing. So we just wanted to share with you that there is a tool that's in the works. It's being compiled as a part of our suite of reimbursement tools. You can see in your lower right-hand corner the link where this tool will be uploaded in the coming weeks, and where you'll find, again, a half dozen or more existing tools around health center reimbursement. But as related to self-measured blood pressure, first, the good news. The good news is that during the current public health emergency, so in the phase that we're in currently, there is a CPT code 99473, as you can see on the screen. It is the only SMBP code that's on the telehealth list, and therefore at this time, and I'll say in a moment why, is the only code that is reimbursable. And what that code represents, you can see in that third bullet down, it's CPT 99473, is that for education provided by clinical staff on the setup and use of an SMBP device, which has been validated for clinical accuracy and calibration. So again, very in keeping with our conversation today. It's reportable once per device. And as you can see here, the rate at which CMS is reimbursing FQHCs currently is $99.45. So as you listen to the devices and as you're thinking of launching and or you're in progress with your SMBP programs, know that this code 99473, it's billed by health centers as G2025, but there is a reimbursement for that initial patient education, training, and device calibration. So very important. The downside of the news around reimbursement is that outside of the public health emergency or in the current landscape, when the public health emergency, a lot of the relaxation of rules sunsets, that currently SMBP, which is considered in terms of the coding world, part of remote patient monitoring, it is not reimbursable as a standalone service by health centers, that it is considered included as part of the PPS reimbursement. Again, there's some work that we can do here at NAC and elsewhere to try to affect change there, but do know that outside of the public health emergency at the current time, SMBP is considered a part of the PPS reimbursement. So again, I guess the message here, the takeaway is certainly that initial billing around patient education and training and calibration is key in terms of health centers securing that. And then stay tuned for this brief reimbursement tips that will be coming out in the coming weeks. We're putting it together with our colleagues, our financial colleagues here at NAC, with other subject matter experts around coding and billing, and that will provide much more guidance and much more specific details in terms of the best way to maximize reimbursement related to this important service. So with that, I'm going to actually turn it back to my colleague, Danny Hawkins of NAC. Thank you.
Thanks, Cheryl and Danny. It's over to you to continue this important topic of payment and cost for devices and how to get the best possible discounts.
Excellent. Well, thank you, Meg, and thanks to all of you for participating. And we can go to the next slide. We'll jump right into it. So strategies for maximizing grant funds. There are two major ways: utilizing an existing GPO affiliation or organizing group buys or promotional purchases. We'll get into the details of each. But most health centers today are affiliated with one group purchasing organization or another. And those affiliations are generally part of any health center's purchasing strategy that they use every day to control their cost. And I see here that many of you on this call are either health centers, primary care associations, or health center controlled networks. So the first thing that I would suggest is if you're a health center, you should look to see if you have a GPO affiliation and what products are under contract. If you represent a PCA or a health center controlled network, it's to recommend that the health center first check to see if their GPO affiliation has any of the validated devices under contract. With a simple keyword search, health centers can look to see if the products are under contract with their affiliated GPO. They could type in a supplier name. They could search by product category, like blood pressure monitors. They can even look by material number, which is more common parlance, or product SKUs. But these are all ways that they can search a GPO contract catalog to see if any of the validated devices are under contract with the GPO. And if a validated device is not under contract with the health center's GPO, then this is where the opportunity in negotiating with suppliers, any of these suppliers that are going to be speaking next, it's the opportunity for PCAs and health center networks to play a role. So next slide. So group buys are essentially organized purchases. Your PCA or network can help manage the purchase of, let's say, 500 units between multiple health centers. This is sort of organizing large purchases. And you would have to talk to each supplier to determine what the threshold is in order to meet a particular group buy price. Promotions are essentially a set price with a sunset date, whereby PCAs or health centers might offer some light promotional assistance to those suppliers in getting the word out about a promotional price that's available to them. One critical part when having these discussions with suppliers is whether what you're negotiating is acquisition cost or end user price. And this is an important piece of information. As you can see here in my example, there are two components generally that drive the end user price. When I say end user price, I'm talking about the health center's invoice price, the supplier cost, and the distributor markup. As you can see here in my example, the Hillrom blood pressure monitor sells, let's say, for $85 per unit. That's the acquisition cost. The dealer or distributor markup, which is the organization that actually delivers the products to health centers, may charge a price markup of 10% or $8.50. That dealer markup is a percent on top of the cost, which results in an end user price of $93.50. If you're a member of the PCA or you're staff to the health center controlled network and negotiating with suppliers, you're going to want to know whether what you're negotiating is, again, acquisition cost or end user price. Normally, it's going to be acquisition cost, which means that most health centers are going to be on their own to determine what the distributor markup is going to be. And we'll get into that here in a sec. But it's not uncommon for suppliers, again, to only want to negotiate acquisition cost. So you'll need to make those determinations. And then finally, with respect to delivery of product, I just want to say here, another consideration is that you need to be aware that in general, there are presently challenges in the supply chain specific to device components, microchips and other materials that are used to make these products. And it may delay delivery time. So when you're talking to suppliers, you're going to want to figure that out. You're going to want to ask them if there's anything that may delay delivery time so that you're able to set expectations with health centers. Next slide. Okay, so next steps. Determine your pricing strategy. Do you have the bandwidth to organize a group buy? Or is it easier just to negotiate a promotion and to promote a promotional deal? You also want to ask yourself, when speaking to suppliers, is it or what you're negotiating, is it an acquisition cost deal or is it end user price? And then determine your time to delivery. When can your health center members expect to receive shipments? Coming back to the distributor markup, if you're only negotiating acquisition cost, don't be afraid to ask the supplier if they have a recommended or suggested distributor markup. If they don't have one to offer, that's okay. You can actually go to your health centers and the health centers can determine what they're currently paying in distributor markup. They would essentially go to the same GPO contract catalog, which lists the acquisition cost for products under contract, compare that against the invoice prices that they're paying, determine the delta and the percent difference, and that'll give them an idea, each health center an idea of what their current distributor markup is. They can utilize this data point to then address what sort of distributor markup they should be paying above the cost that your PCA or health center controlled network has negotiated. One last thing I'll mention, I've reached out to all of the validated suppliers, device suppliers, and have asked them if they have any interest in negotiating a special health center price, if you will. And I've heard from 3 that have indicated their interest in doing just that. So there is an interest out there. It's just a matter of figuring out the details, as I've done my best here to lay out for you. But with that, Meg, I'll turn it back to you and we'll go on. Thank you.
Thank you, Danny. Really great information and much appreciated. So at this time, I'm very excited to give the floor over to our device manufacturers to provide an overview or profile of their home blood pressure monitors in light of those key considerations that we shared earlier. So this would be a good time to take some notes. You can feel free to use the Excel template we provided. There are several copies of the link for that in the Q&A if you need to access it that way. We'll be starting off, we're just going in alphabetical order today, starting off with A&D, followed by Hillrom, Wellchannel, Omron, and Withings. And just a reminder to our presenters, please keep your presentations within the 5 to 8 minutes so we have plenty of time for the remaining Q&A. Greg, let's get started with you.
All right, well, thank you very much, and thanks for the opportunity to address everyone today. As mentioned before, I'm the Chief Operating Officer with A&D Medical, and we have been involved in self-monitored blood pressure from the very early days. We are actually the originator of the first automated digital home blood pressure monitor that goes back to 1984 for us. I couldn't agree more with NAR's points on the relevance of clinical validation. That's always been a significant part of how A&D brings products to the market. We stress clinical validation for each and every one of our devices as we've developed it. And as we've progressed through our 40 years of innovation, we also saw some of the needs that Deborah was referring to, and having a connectivity path to flow the information from a patient monitor being used in the home to an EMR, or at least to a physician for review. So we also we're fortunate. We launched the world's first connected blood pressure monitor back in 1988. This was at a time when wired connection was still the chosen path, And 6 years later, we actually extended that and began launching wireless connection. That was our first Bluetooth device. Today we're talking about home blood pressure monitors, but A&D has, a full diagnostic line of products, which I'll touch upon just ever so briefly at the close of this presentation. And I think something else that's important too is to think in terms of how much of the value chain is controlled by your supplier. So A&D designs, manufactures, delivers, and then provides the technical support for our products. So we are a one-stop operation from that standpoint. As we go to the next slide here, you can see a few of our home blood pressure monitors as well. So we have a wide range of things that are potentially suitable. I'm going to focus on 2 items today, but you see everything down from sort of a basic essential blood pressure monitor without connectivity, but provided at a very low cost, up to our most sophisticated connected blood pressure monitor in the lower right, the Ultra Connect. As I said, I'm only going to focus on a couple of these in the discussion today, but I did want to highlight as well to Hillary's point about the need for very large cuff sizes to address some of the U.S. population. We have a specialty device here that you see in the upper right-hand corner that goes beyond even what had been flagged earlier in the presentation. So this is the largest cuff you can get for a home blood pressure unit is available on this device. Price points across this range of products get down to as little as $25 a device for the simpler devices, up to sort of the $100 range for the more sophisticated. Another element that maybe plays a role for some of your institutions is our talking device listed there in the purple. So this will actually provide coaching assistance for users who are visually impaired. It provides language prompts in English, Spanish, and French as a potential assist to some of the population here as well who might have some visual impairment. But let's turn to the devices that I think are most appropriate for the discussion today on self-monitored blood pressure. So on the next page, we start off with our UA651 BLE. And I must confess, while this device has been clinically validated, as Nara indicated, those standards change over time. This was validated to an older standard, which is not one of the ones that is currently accepted for the VDL list. We are just finishing redoing the clinical validation on this device. That should finish up in the next couple of weeks, and then we'll be taking advantage of submitting this device to get it listed again. Once again, this had been clinically validated and third-party reviewed, but it just was done at a time before the latest ISO standard came out, and therefore cannot currently be included on the VDL, but should be included on the VDL shortly. For us, this is sort of our workhorse device in this space for self-monitored blood pressure. Very easy to use. It has a highly rated heart track app that's free for the end user and provides connectivity back to the clinicians and physicians. It comes with a standard cuff that hits about 80% of the population, but there are other cuff sizes available. And A&D as an entity sold a little over 100,000 monitors like this to institutions interested in doing blood pressure monitoring at the home and collecting that data remotely. On the next slide, you can see a more sophisticated device. So this one actually is worn on the upper arm, connects into the same app that was mentioned before so that you can use it with either an Apple device or an Android device. This one is on the validated device list currently. This was a more recently produced product for us, so it fits in that latest standard. And this gives you the advantage of not having the separate unit sitting on the tabletop, as you'll see from some of our other products here. And then in closing, if we just want to go to the last page, I want to talk a little more about the breadth of the sort of products A&D develops. So Nar mentioned that ABPMs are on the device list as well. So we have an ambulatory blood pressure monitor of ours is currently on the validated device list. And then shortly for sort of that pharmacy application, we'll have that kiosk-like device also added to the validated device list. So, we, as our fellow manufacturers in this presentation, fully committed to having, a wide range of products available for you on the device list so that you can take full advantage of that. And with that, I think I turn it over to Vince and John with Hillrom Wellchannel.
Absolutely. Thank you, Greg. Really appreciate that. And once again, thank you to the NAC and everyone that's organized this and for all the participants. There's a large group here on the phone, or on the call here this afternoon. So thank you very much for your time. As Greg alluded to, I'm Vince Constantine with Hillrom Wellchannel, and I, along with my colleague John Hogan, will walk through what we have to offer in the home BP space. Many of you know the Wellchannel company, and you've utilized our products for many years, whether that be otoscopes, ophthalmoscopes, lighting products, physical assessment, thermometry, cardiovascular monitoring, blood pressure, pulse oximetry, etc. You've utilized our products and have for many, many years. And this is just another piece of that puzzle as we really are working together and working with our partners and our caregivers to advance care. And advanced care where the patient is. And we realize sometimes that patient's not within the four walls of our clinics. Sometimes it's meeting that patient where they're at, whether that's in the home or wherever care is needed. If you can go to the next slide, please. So the product that we're going to touch on today is the Wellchannel Home Blood Pressure Monitor. It's a very simplified device. Many of you maybe have seen this. It's part of the Million Hearts program back in 2017. Perhaps you've seen this in some of the other facilities that you're working with, but this is really kind of the workhorse in this particular space for Wellchannel and Hillrom. You go to the next slide, please. I realize this is a little bit of an eye chart, but this hopefully will kind of walk us through some of the criteria with this product to hopefully meet your needs and some of the things that have been outlined here earlier in the presentation. I think the first thing with this is it's extremely simple to use. It's a simple, easy, one-button operation device. So it's press one button, that starts it, that turns it on, that starts the reading, takes the reading. We'll touch on how that gets over to our app and clinical portal here in a second. But from the usability standpoint, it's a one button operation. The next part of that is around accuracy. And there's really two pieces that really kind of form that accuracy piece with a device like this. First of all, it's cuff sizing. So the cuff sizing that we have with the device, it comes with a standard cuff, which is 22 centimeters to 42 centimeters, or about 8.5 to 16.5 inches. We do have the capability with this device to have an extra large cuff, 40 to 54 centimeters, which is approximately 15.5 to 22 inches. And we also have, if you needed it, a small adult cuff as well. So the nice thing with this particular product is you're meeting the needs of your patients no matter what size they are. And as was alluded to earlier, having this extra large cuff is really one of the big benefits with utilizing our product. The next piece of this is in our SMBP technology. This is the same technology that you would see utilized in other Wellchannel devices, other clinical devices in a med-surg setting, a primary care setting, in our monitoring products. And this SMBP technology takes the reading upon the inflation. So that algorithm allows, as soon as the cuff gets tight, the reading is taken. So instead of the step deflation, it takes it upon the reading. We find that to be more accurate as well as more comfortable for the patient. And it really reduces the amount of time it takes to take a blood pressure to less than 20 seconds. The next part of this is the connectivity. And this device is Bluetooth. As was outlined earlier, is one of the requirements with this. And so Bluetooth connectivity allows for the device readings to then move over to an app. We have the Wellchannel Home app, which can be utilized on any smartphone device, whether it's an Android or Apple device. You download this. This is all free of charge. Download it from either Google Play or app, depending upon the device that you have. And we'll explain a little bit about that here in a second and just kind of some of the workings within that. And then the next piece of this is also our clinical portal. Our clinical portal is also free as well. This is where the patient readings would then reside once they go from the device to the app. And the patient readings would then end up in the clinical portal, which would be on the health center side, where you can review those information in a graphical format. We'll go through that as well. The other piece for the connectivity is not only connectivity to the app, but also connectivity as it relates to electronic health records, whether it be a company like eClinicalWorks or Epic, where we have interfaces available. We also have in the works with NextGen and Athena. And we also have the opportunity to work with different RPM vendors. And if those are things that you're interested in, please, by all means, make sure to reach out to us via email or to your local Wellchannel rep to learn a little bit more about that. So before I turn this into the next slide, John, is there anything that I missed there, anything that you wanted to add?
No, you can advance, Vince. Terrific job.
Okay, thank you. On to the next, Elizabeth. So this talks a little bit about the Wellchannel Home app. This is a very simple one-time setup. You download the app from the Apple Store, or the App Store rather, or the Google Play Store. And this is where the readings would reside once they're taken from the device. The device has 99 memory for 99 readings, but once it connects with the app, all those readings would download. So if a patient forgets to have their phone on or near them or near the device when they take the reading, and they take maybe 3 or 4 in that day, they're still stored on the device. And then once they connect the device to the device is in range, then all those readings would then filter over to the app. The app allows for patient engagement through an easy review process. So they can look at their measurements in a graphical format, a list format. They can look at the past week, month, year, all the readings that they want. And it makes it really simple for that interaction to take place. To connect the device, it's a one-time setup. Initially, when the patient gets the device, it's a simple 2-second process to get the Bluetooth device connected over to the Wellchannel app. Next slide, please. This talks a little bit about our clinical portal that I mentioned. So this is also at no charge to you as the clinician or the health center. This is where the patient readings would reside. So you have a particular patient, you can look them up over a period of time. You can look at their high BP, the lowest BP, the number of readings they've taken in the last, whatever it is, 7, 30, 60, 90 days, all the readings. You can also look at their averages. You can look at it in both readings and see all the different data set points, as well as the dashboard then allows for anything to be looked at in a graphical format, and allows you to continue to work with that patient, monitor that patient, make sure that that patient, as you're going through your different metrics and protocols, is managing and doing a good job with helping to control their blood pressure. So John, once again, I don't know if there's anything that I missed there, anything to add along with the app or the clinical portal.
No, you've hit all the points. I guess before you advance, Vince, one quick thing. Danny talked earlier about the supply chain. Vince did not address this yet, but we did want to make everyone on the call aware that we're very aware of the component shortage, and we are doing everything we can from a Hillrom standpoint and throwing the weight of our brand around to secure components and make sure that we're expediting freight. I can tell you that one of the glamorous portions of my job is allocating product that comes in, and we are making sure that CHCs get priority number 1 in terms of product that is arriving into our warehouses and then shipping out to the customers. So I wanted to make sure I put that plug in and give Vince a breather here from the conversation.
Thank you. Awesome. Next slide. Yeah, so just to kind of recap, just from a product differentiation with the Wellchannel device, as was mentioned, these products are on the Validate BP list. This particular model does have the extra large cup availability as well as extra small cup availability if that is of interest to you. The Bluetooth and the clinical portal allow for monitoring. They are free from the Wellchannel App Store, and they're free of use to you. This single button operation makes it very simple for the patient to utilize. There's connectivity as part of this as well, whether it be to the Bluetooth, just from Bluetooth to the smartphone device, electronic healthcare records, as well as if there's interest in pursuing different RPM vendors, as well as this SureBP technology. It takes the reading upon the inflation. There is the availability. It does run on AA batteries, but if you do need to have an AC adapter, that is an option as well to get the device with an AC adapter. So we really try to make this in a one-stop kind of package to meet the needs of your clinic as well as your patient, to make it simple and to get the accurate readings that you have come to expect from Wellchannel. So with that, I will turn it over from here to Carol with Omron.
Thanks, Vince and John. I appreciate it. I'm Carol Lucarelli, Director of Marketing and E-commerce with Omron. It's our mission, total Omron, to improve lives and contribute to a better society. And I can't think of a better way to share that with this group organized today and share our mission of going for zero and really working with our colleagues at the AMA and with the American Heart Association to eliminate heart attack and stroke. So we know that knowing your numbers is really what empowers patients to put themselves out of harm's way. And we want to help people live their healthiest lives. So next slide, please. With Omron blood pressure monitors in general, we know that with our research with both healthcare providers and patients alike, there are three key drivers that they look for: reliability, ease of use, and accuracy. And I think it's great that both the healthcare providers and the patients focus on those same three issues. From a reliability perspective, we designed the Omron blood pressure monitors to last. In fact, we offer multi-year warranties on most of our models. From an ease of use perspective, we know that patients, especially as they age, it's very important for us to display those numbers in a way that they can easily identify their point in time readings. And that one button operation is very important so as not to confuse patients when they are using the blood pressure monitors. And certainly accuracy. If you don't have an accurate blood pressure monitor, what's the point, really? We hold ourselves at Omron to a higher standard than what is required by the FDA. So we're very proud to say that we've sold more than 200 million blood pressure monitors. In fact, later this year, in the next few months, we're going to hit the 300 million mark of units sold worldwide. In the US, we're very fortunate to be able to say that we're both the number one doctor and pharmacist recommended brand and the world's #1 blood pressure monitor. And I would be remiss if I didn't thank Nar for his comments earlier about the validated device listing. We're very fortunate to have 10 of our upper arm blood pressure monitors represented on the VDL. So in the next slide, let me talk about some of the features that are incorporated into many of our blood pressure monitors. Next slide, please. Thank you. So we know that ultimately it's going to be behavior changes that support better outcomes. So when you look at the patients and they need to change their behavior to monitor on a regular basis, what can we do as a supplier of blood pressure monitors? We can make things more comfortable, fast, and easy. And so we've built in a few features like IntelliSense technology that automatically determines the correct amount of pressure, resulting in a faster and more comfortable blood pressure measurement for the user. We've incorporated 360-degree cuff rotation, and that allows for more accurate readings regardless of the cuff alignment on the patient's arm. We do have a wide range cuff that is sold standard with our models that provides broad coverage for many arm sizes and helps really eliminate errant readings because cuff sizing is so important in that. And then finally, like the manufacturers before me, the idea of connectivity, and that's to capture the data in our free app, Omron Connect, and create an easy opportunity to share those readings, both with healthcare providers and others. So what is going to happen when, how do we get patients to change their behavior and actually improve their heart health? We provide data and the context of that data and even coaching. So within Omron Connect, our app that I've mentioned, patients can see their trends over time, and they're more likely then to connect their behaviors, both good and bad, with their readings. So some simple questions that we ask in the app at the end of the day: did you take your medicine as prescribed? Did you exercise? Did you consume salt or alcohol? Answers to those simple questions then provide a coaching message the next morning, so that hopefully that connection between behaviors and blood pressure becomes more commonplace with the patient. And then finally, providing educational information. Just one example, a video that I captured here is to help support the patient's appropriate use of devices. And it also helps level set the expectations for accurate readings on the part of the healthcare providers. On the next slide, I'll talk a little bit about our new entrant into remote patient monitoring called VitalSight. We ran a couple pilots starting last calendar year with the likes of Mount Sinai in New York and Northwestern Medicine in Chicago. And we were very proud to be able to unveil this at the Consumer Electronics Show back in January. But it's the continuation of our mission of going for zero, that elimination of heart attack and stroke. The kit is ordered by the physician in the EMR, and it's really not about the devices, but more about the service that's being provided. The physicians can remotely monitor their patients' heart health, and it's designed for patients to take in-home blood pressure and or weight measurements, which is very important with congestive heart failure. By ordering this, the kit is sent out to the patients rather, and it is prepared. So the data hub covers the issue of Wi-Fi or cellular data. No extra instruments are required. This data hub will put the data into the cloud, and then it is automatically integrated into the patient's EMR. So this is allowing clinicians in real time to provide proactive and corrective treatment with VitalSight. And on the last slide that I have, next, again, we want to continue to power this mission of zero heart attacks and zero strokes to help people live their healthiest lives. So thank you for participating with Omron, and thank you for your time today. I'm going to now turn it over to Tim and Logan.
Thanks, Carol. My name is Tim Shipman from Withings, and as you guys probably are all familiar with, this is a bunch of pitching stuff, so I'll try to make mine pretty short and sweet and tell you really where Withings strives to kind of advance the game here. So if you could go to the next slide, that'd be great. So we've been in the market for about 12 years now, and we've really strived to pull lessons out of our direct-to-consumer sales. And what that's taught us is, from a pool of millions and millions of users, we've been able to learn what gets users engaged on a daily basis, what keeps them engaged with these products over multiple years. And that's really become our obsession. If you could go to the next slide, that'd be great. Thanks. So we've proven ourselves through a bunch of different medical expertise things. We've been at CES over the years. We strive to focus on the low-hanging fruit around battery life. We know that if you force a user to recharge a device every other day, it becomes a cumbersome experience for them. If you force them to plug into a wall, it becomes a thing that's tethered for them. And so it became very important to us that we look at all of these things from a user and provide them a best-in-class experience. If you can hop to the next one. This is kind of just a brief slide about our medical advisory board. We'll skip over this because we only have a couple more minutes. Cool. So back to my point. Withings really strives to solve two main challenges: installation rates and retention rates. And this is really the core of what Deborah was talking about with things that you need to consider for an end patient. What is their life really like when they get a device in their hand? How do they actually interact with that device so that they can get data and quality, reliable data to you guys, the caregivers? And that's where our obsession is. The other thing is retention. Obviously, if they're not using the device day over day, it becomes a useless piece of junk in the corner that just sits there. We're really excited to tell everybody about the last 2 years. We've done studies about users that use our BPM Connect. Do we get to say we have an 85% patient retention rating on our consumer side for that device after 24 months, which is absolutely huge. Keeping patients engaged is the number one way we're going to keep them healthy. You can hop to the next slide. So we also have another version of our base BPM Connect, and we're excited to give it to you guys to look at and validate further. It's going through the FDA stuff now. We hold ourselves to a much higher standard as well. We pick all of our devices, and we partner with many hospitals throughout the country, including Johns Hopkins and the Mayo Clinic, to really test and validate these devices. We do want clinical validation behind these things. And so we're doing that now with a new device that will be a cellular enabled BPM Connect with fallbacks to Wi-Fi and Bluetooth when cellular isn't available for the patient. So, and really what this all culminates to is the device just works right out of the box. There isn't an app to install. There isn't a technical setup process. There's a device that shows up with an instruction guide of how to turn it on, which is just as easy as push a button. And then the blood pressure works. All the data goes straight to the cloud. We can hop to the next slide. So this is what our device looks like. This is the Withings BPM Connect and the BPM Connect Pro, which will look identical to it. I have one sitting here in a box next to me, just off screen. And we can hop to the next one. So both the Pro and the Connect will have Wi-Fi and Bluetooth built into the device. The reason we strive to have Wi-Fi built into every single device is because we want the device to automatically upload the patient's data rather than forcing a patient to open a phone and have another thing they have to do. When we force that, we see a couple of different things happen. People forget, they get frustrated because technical interfaces are necessarily their forte, or generally it's kind of natural to have your phone sitting there with you playing in your hand as you take a blood pressure reading. And so we really strive to push that as a fallback option where Wi-Fi can happen in the background, or with our new device, cellular can handle it all together. We can go ahead and hop to the next one. As I said, we designed this thing to be quick and easy and fun to use, so we made it really small. We want you to be able to travel with this thing. We want our patients to be able to travel with it. We want it to record readings even when the patient's not at home with them. They can take it with them on the road. It keeps their data active, and it tells them more contextual information about their lives. We don't just do one reading with these devices. We have the option for single readings, or we have the option of multiple readings and then averaging the data across 3. We can hop to the next slide. We also offer our customers immediate results. Like everybody, it's important to kind of give that information back immediately. And so we put a nice little color button on there where a user can easily see exactly where they stand. Is it a grade 3 hypertension reading and it's red and they need to have a conversation with their doctor? Or is it totally fine and they've been following their instructions well and their blood pressure is in a good position? We have the ability to kind of give that feedback right away. We also have just a singular interaction point with one button on the device, and that's used for turning the device on or changing the reading settings, but it's incredibly intuitive and easy to use. We can hop to the next slide. So again, thinking about the patient, we want this to be as simple as humanly possible for them. We want them to get the device, turn it on, take a reading, and set it down. That's it. We don't want them playing with their phone. We don't want them doing a big technical integration lift. We don't want them playing with batteries. We want them to be able to just charge the device up when the battery dies. We want them to be able to just take a reading when they want to take a reading and not have to play with a bunch of other things. And that's what our cellular network is built around with our BPM Pro, and our BPM is just as simple with the integrations we'll talk about here in a second if we hop to the next slide. So as I said, we have a couple of different ways to integrate with our devices. We have an API integration that allows you as a clinic to pull down your patient's data directly from our cloud after a user takes a reading. We have an SDK interaction, which allows you to embed an onboarding flow directly into your mobile app or your web experience, so that a user never needs to be aware of the Withings ecosystem outside of the device. They don't have to go download a second app to register it. They just sign up with you guys and the device pulls the data that way. We also have several logistics options. We understand that it's difficult to manage inventory, stock, and supply chain. Let us handle that for you. We have the ability to bulk ship you guys everything you need, or we can sit on it and we can send it directly to your customer. We have that built into our supply chain, and we're happy to kind of leverage that. On the lowest end of technical integrations, we also have our Withings HealthMate app, which has been used both by our consumer side and our B2B side for many years. And all users have to do is download the app, sign in, and register their device. Like I said, it's all built around simplicity and ease of use. I'm going to pass the mic over here to my colleague Logan, who can tell you a little bit more about our EHR integrations and how you can get our data that way.
Yep, awesome. Thanks, Tim. On the next slide, we recently just partnered with a company called Redox that allows us to pull in device ordering and data flow within the EMR. So within your EMR, no matter what EMR you're using, you don't have to go outside of your workflow to order devices to have sent to the end user patient's home. We will drop ship those devices. We remove any sort of consumer sleeves with these devices, so there's no confusion for the patient on device setup. We really customize that experience. And so the providers just order devices within your normal workflow process, and then an automatic data flow back into the patient's chart. It's about a 6-week project for us to build out an interface with a health system. And so that is the only thing to keep in mind is time frame. But getting this built into your workflow process saves time and not have to go outside of your normal workflow. Next slide. So as Tim said, everything we do is based on the patient experience, but also on the clinic experience as well. So using the Epic as an example, just ordering those devices within your workflow, that goes to our warehouse. Our warehouse fulfills the order, ships to the end user's home. They receive the devices, unbox it, and just power on the devices, and that's it. The data will automatically flow back into Epic, or it can go via the Apple Health app if the health system is connected with Epic and Apple Health that way. So we have a multitude of connectivity options. It just kind of varies on the customer, but the goal is to reduce any sort of friction for both the patient and provider. By doing this with the cellular enablement, removes patient friction, so it drives adoption. And then on the clinical side, this workflow process will drive adoption and really inhibit the ability to remotely monitor with a multitude of devices, not just our blood pressure device. And with that, that is Withings, and next is the Q&A session.
Great. Thank you so much to all the presenters. We're really excited to hear from all of you. I know there's been lots of questions in the chat. To address some of those, we are going to start with some of the payment reimbursement questions first, and then general CUF questions. I know there are several questions that are for specific vendors. We will get to those towards the end if we have time. I do encourage all of the vendors that if you see questions specific to your brand, to try and answer those in the Q&A. If not, for those attendees, fear not. We will get those answers to you and send them out in a later FAQ. To get us started, I will start with a question that is related to reimbursement using the billing codes. I believe Dr. Mike Raycox or Hillary Wall may be the best for these, but anyone who can chime in from the panel. So a question was, can a clinical pharmacist be reimbursed for the 99473 code at an FQHC?
So hoping that we have someone on the line who is an expert with the billing codes to provide a response for that question.
And further reminder to my panelists, this would be a great time to share video and just locate that unmute button. You might be talking right now, but your line is muted. So just wanted to remind you. Thank you.
Dr. Raycotts, do you want to respond to that?
Yeah, sure. I can. Well, let me start by saying I am not going to be able to give you a definitive answer today. It's a question that we've asked for clarification on and don't have that answer yet. So when we have that clarification, I will get back to you. I just don't want to misspeak to this audience. I'll just say that's a follow-up answer that we will provide as soon as we have the clarification.
Great, thank you. There's a second question related to some of the billing codes, and the question is, do the codes 99473 and G2025 need to be billed together, or can 99473 be billed alone for reimbursement?
So I'll start that, and again, Dr. Raycotts, you may want to jump in, but one of the things, and again, I am not a billing expert. I rely on both our NAC financial folks as well as some billing and coding experts. But the thing that I've learned, and again, I will refer you to the reimbursement tips that are on NAC's website, and the link will be in the slides that are being provided. But one of the things that you'll see and that our billing and coding experts strongly encourage is that providers always code the CPT code. So they are coding the 99473. And then it's the back end, it's your revenue folks or your back office folks who are then submitting, and it's the 2025 that's on the back end. So again, what you instruct, how you instruct providers to code is one thing, and that's the CPT codes. What actually gets submitted to be reimbursed is the reimbursement code that we spoke about, the G2025. So the reimbursement tips provide some pretty strong guidance in that area on 7 different topics. And again, to echo Dr. Raycotts, as we clarify some more details around self-measured blood pressure, we'll also have that same level of detail for SMBP very shortly.
Yep,
Yeah,
and
I agree with that. This is Mike. I was just going to say that for 99473, if the education and training occurs, then submitting that CPT code 99473, if a validated device was involved, is totally acceptable from a CPT standpoint. But again, I can't comment on the requirement of what would happen next for submitting for reimbursement with the G code on top of that.
Yep, and I was just going to input with the Center for Connected Health Policy has a really good guideline on billing for telehealth encounters for these types of things. So if you don't have my contact information, hopefully we can get that to you, and I'm happy to send that guide out that does speak on these codes and kind of give some really good insight as a good reference point for you.
Okay, wonderful. Thank you, everyone. So I'm going to shift this question about the pricing for cuffs, and Danny Hawkins, this may be best for you. Wonder if you could share, like it was mentioned that there are 3 manufacturers willing to give or provide FQHC pricing. Can you name those companies again and their contact information?
Yeah, we'll provide that post call to Meg Meter. Those conversations are at different stages, but what I can tell you, there are some that we're actually settling in on a price or at least acquisition cost, because it won't include dealer markup. But the other 2 suppliers have expressed an interest in doing something similar. The one supplier that we're talking to, where we've identified an acquisition cost, it's probably going to be more of a promotional price or cost that sunsets sometime later this summer. But as we get more detail and finalize those things, we'll let everyone know. And Meg, what I'll likely do is provide you with all the information, and then you can sort of push that out to everyone on this call, as well as providing any contact information of a chosen contact at each of the dealers or manufacturers, rather, in case anyone has any follow-up and wants to contact them directly.
Perfect. Thank you, Danny.
Indeed.
Great, thank you. This next question may be specific for Nar Ramkissoon, but for those who know, please chime in. Is there a way to sort or specifically identify validated devices that have an extra large cuff size? I know we saw a lot of different devices of varying sizes, but is there a way to sort or better identify those that have the extra large cuff size?
Yeah, I can take that. So today on the website, each device model does have details on the cuff size measurements that are available for each. Unfortunately, today, it's not possible to filter just for specific cuff sizes. That is definitely a feature that we're looking to add later, even over the next couple months. My suggestion would be to try printing the whole list, because then the cuff measurements are attached to that printout. And that way you're able to kind of quickly skim and identify those that have an extra large cuff available.
Great, thank you.
Hey, Rita.
Oh yes, go ahead.
This is Cassie. That will also be a feature that we have on the at a glance document that will be available soon. So you'll be able to see a column for all the devices that are validated and then also for all that have an extra large cuff. So that will be out soon.
Perfect, thank you. So great news, everyone, more information to come. This is more of a question for all the vendors. If you could briefly just share just a recap on this particular question. There are some that are mentioning that they are struggling with the use of the Bluetooth devices for those who don't have a smartphone or tablet. Could you just quickly recap if there are cellular options for any of these devices and any specific recommendations?
Yeah, so I can start from the A&D perspective. We don't have any native cellular connectivity in our devices, but we do have a number of portal devices that'll provide the connectivity without a cell phone and a hub, somewhat similar to what was described as part of the Omron Vital Site solution.
Yeah, this is Vince Constantine from Hillrom. With the current mix of the product that we have, we just have the Bluetooth option. There's no cellular connection within the device. We do, however, are working with some RPM vendors that do have the capability to connect without utilizing the Bluetooth portion of it and utilize a cellular device. So more information on that, but that's how we handle that.
Hi, this is Tim Shipman from Withings. So we obviously have the BPM Connect Pro, which is a native cellular device in its own right. Doesn't need anything else with it, just works with it. It also has built-in Wi-Fi and Bluetooth fallbacks for when cellular is not available. We also have the standard BPM Connect that can connect with several RPM vendors' solutions already out there. And then we offer a cellular hub that works with our baseline BPM Connect and several other devices. So you can send an ecosystem of devices. Currently, we have a sleep mat that does breathing disturbances, and a handful of other devices, including a fitness tracker and a scale that connects to that to create a larger whole human ecosystem for patient monitoring. But yeah.
And then from an Omron perspective, we are making use of the Bluetooth in the majority of our devices. It's really the hub that we utilize with our Vital Site program that is completely independent of any other services required.
Thank you. Any other feedback? Okay, wonderful. Thank you. This one is also for the vendors as well. Do any of the vendors specifically interface with the Medent EHR? It's MEDENT.
From A&D's perspective, we've successfully interfaced to any number of EHRs. I do not know of a specific instance of us directly interfacing to Medent, but I wouldn't see that as an overlay, as a integration that couldn't be done.
Yep, and this is Logan at Withings. Through our partnership with Redox, we can absolutely make that happen if it's not on Redox's already connected list. It just takes a few weeks for them to get that added with these smaller or other EMRs that they haven't connected with yet. So absolutely.
And John Rubin here from Wellchannel, and I'll give Vince a break. Currently, no active integration with Medent that I know of. What we can do is work with you in your facility. The more that you can promote your wish to promote with our devices, the more it helps us kind of connect with them and make sure we have that integration platform built out.
Right. And then from an Omron perspective, for those patients who are utilizing Omron Connect, that app does allow for the collection of data to be sent to anyone, physicians or loved ones included, in the form of a PDF. So from that perspective, the doctors can integrate that as necessary. And because of our partnerships with VitalSite, those can go into a wide range of EMRs.
Great, wonderful. Thank you. Another question, and please let us know if you guys have the answers for this, but question is, what types of support or resources may be offered by NAC or manufacturers around ongoing calibration of these devices, either at initiation or throughout the use of the device?
I can answer from an Omron perspective. It's recommended that the cuff be replaced on an annual basis, which is a lot less expensive than the device itself, certainly, because the devices contain the algorithm and it needs accurate information coming in from the cuff. So the calibration really is not an ongoing need. But we do have our call center. It's a toll-free number that consumers can certainly reach out to if they're seeing errors in readings and such. That staff, that US-based staff, is very able to assist and to point out recommendations in the accuracy of the device. And then we can also replace devices if they're still within warranty to handle that.
Yeah, and from a Wellchannel perspective, calibration is not required. If there's an issue, we encourage the clinician or patient using the device to call into customer service. The majority of the time when there's an issue, it's probably because of improper placement of the BP cuff itself. So we have a number of tools available on YouTube to address how to properly place the cuff. Usually what happens with these devices, and I think everyone can agree, if the cuff is not placed properly, readings get skewed a little bit.
Yeah.
Tim from, oh, sorry, go ahead.
No, go ahead, Tim.
Oh, appreciate it. From a Withings perspective, calibration is not required, but we have a large support staff and team to back up all of programs. Obviously, we have a fairly large direct-to-consumer market, so we've had to do a fairly big effort on support for individuals, and so we have a wide depth of training tools and leverages, as well as just in-person support network that you guys can leverage to get assistance on this.
Similarly, from A&D's perspective, there isn't any physical calibration that can be done on the devices. We warranty the cuffs for 2 years and the blood pressure monitors themselves for 5 years. We do provide instructions, however, and phone support I would completely agree with the earlier comment that that a lot of times it's just not good blood pressure measurement technique that leads to an issue. But obviously, once these things have been deployed and perhaps deployed a few times, there's the possibility that somewhere along the line something has been broken. So we have recommended procedures for a checkout if there's any reason to believe that the device is no longer reading correctly, and then if it's within the 5-year warranty, you just get a replacement device.
Great, thank you. Wanted to go back to Mike Raycox and Shara Modica for a follow-up question about the billing codes. And the question is, can an FQHC bill 99473 if a non-clinical person, such as a patient navigator or care coordinator, provides the education or training? I know, Mike, you said you're getting more information, but wanted to see if this about this specific clinical person.
Yeah, again, it's going to be the same. I mean, pharmacist is a healthcare professional, and I'm not sure what the specific example is, but I can tell you what the code was designed to be: a non-provider or non-physician code. So it's a care team code. There are no physician RVUs for this code. So somebody that is on the care team in a health center absolutely is meant to do this. Actually, not a provider, not a physician for this specifically. So I'm not sure if the question is regarding non-clinical staff in the community, in which case, again, I think it's less likely or unlikely, but I can't say with certainty. Can you clarify the question again?
Sure, yes. They're asking about a non-clinical person, such as a patient navigator or care coordinator who provides the education and training.
Yeah, again, that's a little bit in the gray area. If they're part of the organization, if they're part of the health center and they're trained to do this, it's possible. But I hesitate to say and give bad advice. We're trying to get the answers to these questions, and so the intent of the code was to be for a healthcare professional on the care team, at a health center. Again, a non-physician, a non-provider, but I can't say with certainty whether a non-clinical person doing this training would work for education and device calibration here. So I just don't want to make a mistake and give bad advice. And so again, we'll follow up with this answer as well.
Absolutely, thank you. I know we're getting close to time. As a reminder, there are lots of great questions in the chat, and thank you so much to our vendors and our other panelists for answering them as they're coming. We will be pulling from this list to make sure we create a very robust Q&A and also getting the follow-up answers to the questions that we weren't able to answer today. But thank you to everyone who contributed, who asked questions. We really appreciate it. And I'll turn it back over to Liz to close us out.
Awesome. I think Meg is just going to go over resources and then I'll close it out officially. But Meg, go ahead. The floor is yours.
Super. Thank you so much, Liz. So I just wanted to quickly share that there are several places that you can find resources on SMBP. One is the Million Hearts website linked here, as well as the Health Center Resource Clearinghouse. And we're going to, of course, add the resource Carol mentioned today on reimbursement. I know that's definitely of interest, and you'll be able to find that soon. You can also register for the SMBP Forum. So this is a quarterly opportunity for healthcare delivery organizations, public health, community partners, and others to exchange best and promising practices and identify solutions and challenges or share resources. So that link is there active on the slide. We're going to be sharing the slide deck out so you'll have access to that. And then a final note, I just wanted to make sure that folks on this call who are involved in the HRSA grant for the Hypertension Control Initiative know that the HRSA American Rescue Plan funding, which is a different funding mechanism, can also be used by health centers to purchase home blood pressure monitors. So I have the relevant sections from this opportunity highlighted so you can see where it's stated and also the link to that. So with that, I'll turn it back over to Liz to wrap us up.
Awesome. Thank you so Much, Meg, and I really want to just shout out to our panelists. Thank you so much for joining us today. It was a very robust webinar, and we've got a lot of work to do. So before we end today, again, this event was recorded and will be available for playback. Number two, the resources that were all inside of this PowerPoint, you will get all of those in a nice complete email, as well as any sort of supplementary documents. We're also going to take this FAQ or the Q&A and any questions that we weren't able to answer or we need to take a deeper dive into. We're going to be developing an FAQ and also giving that out to everybody. So no need to fret. Lots of resources coming your way very soon within the next, I would say 5 to 7 business days at most. But again, we're going to give you a nice complete package for you to take to your health centers. Again, thank you so much for joining us. We will see you at the next event with NAC. Of course, our contact information is on the center of the screen. Feel free to jot that down if you have any additional questions you want to submit our way. Have a great day. We will see you soon. Thanks. Bye, everyone.